it's great to be here with Ben Schillens from Orbita today. Excited to have a little conversation to hear more about what you're doing in Orbita and your solutions and the problems you're solving. But let's start with some introductions. Tell us a little bit about your role, Ben, at Orbita.
I've been with Orbita for about 8 years. I'm currently the Chief Product Officer, so I focus on both working with existing customers, prospective customers, understanding what are the challenges that they have, and then translating that into the product and the solution that we offer out into the market.
That's very exciting. And this next question is perfect for our Chief Product Officer, because you're looking at the problems that you're before the products. And what are the problems that you're looking to solve? Why are those problems important?
Yeah, well, key problems that we're looking at is, really focused on, improving operational efficiencies across the healthcare spectrum and improving the patient experience across that are really the two key pieces or the two key pillars that we focus in on. And it really, has a whole series of opportunities that can be, consumed by the healthcare providers, the organizations, the systems, or the specialty departments that we may be working with. And so obviously from a patient experience perspective, we want to make sure we've got a great engaging solution and experience for them so that they're prepared, they show up on time, obviously reducing no-show rates and supporting the organizations. And from an efficiency perspective, we really want to make sure that we're streamlining, automating manual workflows, improving both the administrative staff experience, but also operationalizing or streamlining um, the tasks that the providers are doing that potentially could be moved off to another member of the team or outsourced in some way that could actually improve their throughput and their efficiency with regards to procedures or operations that they're able to complete. So
You're essentially seeing some of the fragmentation and clunkiness as problems in the system. And is it apply to all health systems of all different sizes? You do see these problems exist everywhere?
we do, but they're different.
Okay.
And I say that in the way that we typically engage at a health system level, but then we'll go down into the different departments to understand very specifically their unique workflows, their unique challenges, and it is different from department to department to understand, their key challenges and then what specific workflows could be automated or improved upon again for each one of those departments. So.
Got it. So you're tailoring based on the problems that are unique to a health system and department. And then you mentioned patient too. So that's it. Is it the challenge that it's a clunky, fragmented experience for patients to engage on all kinds of transactions in their care journey? Is that the key problem?
Well, I think the key problem is just once there is an episode of care, how do you help navigate them and move them through the
Okay.
health system appropriately?
Gotcha.
Now, it doesn't always have to be an episode of care. It could be obviously an annual visit or an appointment, but typically when they're at a challenging state within their own health, again, how do you make that as seamless and easy as possible to move through the system or move through to the different providers that they may need to encounter, providers or services that they would need to encounter at that point. So.
That makes a lot of sense. I would imagine any patient would say right now navigation is not easy. You have to really, really understand a lot about how the system works to do that. So tell us about the solution, the product. How are you addressing some of these problems?
Yeah, we've got three solutions that we offer into the market. A digital front door. Now, that digital front door really is focused on helping navigate to the patients, and typically an anonymous patient. We don't know who they are yet, to the right place to get started. That can be deployed at a health system level, but also down again to the department level solution where we may be focused on helping gather some information from initial intake, even screening patients to tell them where they should go and if they are at the right place at that moment in time. So we do have that digital front door solution. And then once we do know the patient, we do have a solution called patient access and acquisition. And that's really gets into scheduling. So being proactive out to the patients for them to come back in for their annual visit. proactive outbound to the patients to help from a referral scheduling perspective when they had an encounter and they now have a referral, making sure they're getting that referral appointment scheduled and booked. And then finally, we have the care navigation piece of it. So now that they've actually come in, they've had their initial consult or scheduled for their initial consult. How do we navigate them through all the steps to prepare for that consultation, post-consultation, and if happens that an operation or procedures planned, pre-procedure prep and post-procedure follow-up. Now, I only named a couple of the workflows in that process. There could be anywhere up to 5, anywhere up to 15 different workflows that may need to be automated in that process. Not all patient facing, but in many cases, there is activities and tasks that you could direct the patient to do that help streamline the internal operations team, the administrative team, and speeding up the process for them.
What's an example of something like that you would?
Well, prior authorization is a good example.
Yeah.
And that one, again, depending on what the procedure may be, there may be a series of requirements that the patient has to complete before you can even submit in for prior authorization. Obviously, you may get approved, it may get rejected. There may be additional steps that they need to do before finally getting approved and then getting their procedure, their operation scheduled at that point in time. But that's a good one to talk about because it helps on both sides organize and streamline the process. So
what does it look like on both sides? Is it an app? Is it because I assume there's a digital aspect to interact with the patient as well as the
yeah,
team.
absolutely. It's all about putting self-service tools and functionality in front of the patient. We engage patients through outreach when we know who they are, and that can be across email, SMS, and automated phone calls.
Okay, so multiple channels. Okay.
Multiple channels, so it's an omni-channel solution. And then even, based on the technology that we have and the AI that we work on, focused on the right channel at the right time for the patient to engage them where they are and how they want to engage back with the provider themselves. So we do have obviously that channel. We refer to it as the patient app, but it's a web-based, mobile-friendly website that they're able to hit, secure, authenticated, in which then they're able to engage in. Typically in a care navigation setting, we're providing a series of steps or actions that we're directing the patient through that could, obviously provide them information in document format and links to the right place within websites to access information and complete forms, videos, educational content, really all types of media that could be consumed or included as a part of those action steps.
Got it. So there is that interactive element. You mentioned earlier, right patient, right channel, right time. How do you determine that? Because I think many health systems struggle with how do we know these patients aren't already inundated with too many text messages? And what is the right way to engage different demographics? Do some prefer phone calls and some prefer an app? How are you thinking about that?
Yeah, so we've got a full analytics team within Orbita, and that's what they focus on. So
Yeah, okay.
first and foremost, we produce insights reports that can be accessible both from a dashboard perspective, but we also send out a monthly executive report to all of our customers, highlighting key KPIs and metrics that really show and highlight the return on investment with regards to our solutions. So that's being proactive and getting that out into our customers. As a part of that, we're looking at the data really across that full journey, all the way from that digital front door, and how we look at that across all of our customers, all the way through to that care navigation where they've had a procedure or post-procedure follow-up activities that may be taking place. And so as a part of that, there's a whole series of data within our repository that we have that we've learned on and that we've been able to train different models against. But as you said, then it's now understanding those patients, that unique patient. And so being able to communicate with them, we do give them the option to manage their profile, set the engagement channels and how they would like to be reached out to. But also based on the technology that we have, we can actually send out different touch points, multiple touch points throughout that process. And again, automatically tailoring to the preferences that we're picking up as a part of the engagement.
That's great, because I think that personalization piece is really more and more important. Uh, just everyone wants to receive and engage in different ways, and it's great that you have that analytics capability. So tell us a little bit about results that you're seeing, because that's everybody's top of mind, right? Because it is an investment to do a digital solution like this, even though the problems are big. But what sort of results are you seeing? What sort of KPIs can you share?
Yeah, absolutely. And as I mentioned, because we have that analytics team and
Right.
we're looking at the data from a month-to-month perspective, again, we produce a report that we send out to our customers that really highlight their KPIs and highlight that ROI that we're able to achieve. Just to kind of give an example,
Yeah.
one customer that we were working with regards to same-day cancellations, we had a 54% decrease in same-day cancellation.
Mhm.
So by
Because
getting
it's a reminder that somebody got that it sort of activated them to come.
Exactly. Being proactive, letting them know the appointment is coming up, letting them know how to, when to get there, their arrival time, also all what they should bring, all the
Yeah.
prep that's needed for that. It's not just a reminder. It's a lot more than that. But because of that, then obviously seeing those same day cancellation rates drop as a part of
Yeah.
that. From an operational throughput perspective, so again, specific departments, depending on the department you work with, you may be working with one that is high volume in which they have high throughput of patients already. But we also work with different departments in which there is the opportunity to increase their throughput.
Mm.
So as we're looking at that full patient journey, we're able to analyze and understand bottlenecks in the process. And by understanding those bottlenecks, what are opportunities to alleviate those bottlenecks? So prior authorization, again, is a good example of one that in many instances could take weeks, potentially months to get through that process. So understanding that and focusing the right time and attention on it even from a staff perspective, you can start to move patients through the process even faster. A lot of our customers, when they're looking at it from an insurance or a prior authorization perspective, they're actually looking at patients that are about 20, only have 20% left activities left to complete to be able to submit. And if they can
Amazing.
focus on that, they can get them in and through the process even faster. So again, it's looking at those bottlenecks, it's understanding those bottlenecks. And by looking at that, you're able to then address them and improve the throughput of the practice. So
Those are some great examples. Um, this has been great learning a little bit more about the solutions, your focus on efficiency as well as patient engagement. And clearly, you're already seeing some great results. Anything else you'd like to share before we wrap our time together?
Um, I mean, events that potentially are coming up. We're going to be at Vive coming up just in a couple weeks,
Yeah.
February 16th and 19th. So that is coming up. We have a very aggressive roadmap as it
Mhm.
relates to product development, and as probably many organizations are really focused on AI.
Yeah.
Obviously, the focus that Orbita has as a healthcare organization is everything has to be proven, everything has to be safe.
Right.
Patient safety is
Yeah.
most
Mm.
important. But very aggressive AI roadmap as we look at 2025. So we're looking forward to being able to have additional announcements and press releases as we go through this year with some pretty neat capabilities that 100% focused on ROI for the organizations. So.
That's really great, because I think that ROI conversation continues to be top of mind. And of course, what is going to be the AI engine for everything? Thanks for your time, Ben. This has been great. And of course, for people listening, you can also find out more about Orbit on our AVIA Marketplace, or reach out directly to Ben over here. Ben, thanks again for your time.
Thank you, Sona. Appreciate it. Have a great day.